Hi everyone, my name is Manna Semby. I'm a naturopathic doctor at the Cancer Center for Healing and Center for New Medicine in Irvine, California. Today we are going to talk about ozone, what it is, what are the benefits, how can you use it, and what are the methods by which we infuse ozone. So first we should talk about what is ozone. So I have these molecular models here which will help us understand. Now we know oxygen is made up of two oxygen atoms. So this is the oxygen molecule which we normally breathe. This is ozone. So this is three oxygen atoms joined together. Now this molecule is very unstable. The extra atom is what makes it unstable. So that dissociates into a singlet oxygen and the oxygen molecule. Ozone, even though it's an oxidant, what it does in the body, it engages the various antioxidant systems of the body and creates more health by mediating oxidative stress. So now we're going to talk about how does ozone work? How does it work in the body? So one thing we talked about is that the ozone splits into oxygen and the singlet oxygen atom and engages the various antioxidant systems in the body. How does it do that? It does that by a few different mechanisms. The first one is it engages something called the Nrf2 pathway. What happens during this pathway is the same thing that happens when you either fast or you exercise. You're creating a mild stressor in the body. At that times there is discomfort, but eventually what happens, you come back stronger, you have more energy, and you improve your health. The same thing happens when you use ozone. It engages the Nrf pathway in a similar way. The other thing that happens with ozone is it increases an enzyme, the level of an enzyme in a body called 2,3-DPG. It's got a long name, but all you need to know is it increases the levels of enzymes which help to create and distribute more oxygen in the body. So the blood is carrying oxygen throughout the body anyway, but if the hemoglobin doesn't have the ability to unload the oxygen at various points in the body, then your organs aren't getting well perfused with oxygen. So even though the body has enough oxygen, it isn't using it well enough. By increasing the levels of this enzyme, you make it possible for oxygen to reach parts of the body which aren't getting that well perfused. And what then happens is it increases what we call the flow of blood, the flow rate of blood, or the rheology of blood. And when you have good blood flow, you have low inflammation and low chronic disease. When your blood flow is impeded, when your blood is thicker and it is not getting to all the organs as needed, you have higher inflammation and chronic disease. And finally, the last thing we want to talk about today that that ozone works through, or the mechanism of action of ozone, is that it increases the ATP levels in your body. ATP is the energy currency in your body. More ATP means more energy, less sickness, more strength, just an overall increased, enhanced state of health. So now we will get into the uses of ozone in a more detailed level. The first thing we want to talk about is the use of ozone as an antimicrobial. Why is this important? We know that an antimicrobial is going to eradicate bacteria, viruses, fungus. Why is this important for us? One, many cancers can be traced back to persistent viral infections. For instance, HPV, or human papillomavirus, is associated with many head and neck cancers and also cervical cancer. EBV, or Epstein-Barr virus, which almost everybody has today, can be traced to nasopharyngeal cancers. Breast cancer is often associated with underlying fungal infections. Many dental infections can become a cause for different kinds of cancer. So we all have cancer cells in our bodies, but if our immune system is strong, it can take care of the cancer cells such that tumor formation does not occur. But if our immune system is not strong, chronic and persistent infections can lead to formation of tumors in our body. The next use of ozone that we want to talk about at some length is its impact on improved circulation and oxygenation. So we already talked about how increasing the blood flow leads to reduced inflammation and reduced chronic disease. So it is widely accepted that cancer is caused and increased by a lack of oxygen in our cells. Okay, and what ozone does is not only it improves the blood flow, but helps the oxygen to reach parts of the body which are not being well perfused. So it is a direct counter to cancer by increasing oxygen in various parts of the body. With cancer and the resulting anaerobic metabolism, which is the lack of oxygen, the body creates more lactic acid, which reduces the pH of the body, increases the acidity, and that increases the chance of cancer metastasis. Okay. So what ozone can do is help to maintain normal cellular respiration by increasing the levels of oxygen and bringing the pH levels back into balance. What ozone also does is increase the levels of nitric oxide in our body. Nitric oxide is a vasodilator. So what it does is also helps to improve the blood flow, leading to increased circulation and oxygenation, and helping to treat and prevent chronic disease. Another mechanism by which ozone helps our health is by increasing the production of antioxidants. So it increases antioxidants like superoxide dismutase and glutathione, which it does by the production of glutathione peroxidase. So by increasing antioxidants, you are able to increase the health of the various organ systems in our body. And finally, it is directly anti-cancer or anti-neoplastic. How does it do that? It increases the output of something called TNF, tumor necrosis factor. What happens with this is that the cells that are abnormal are marked for destruction, and they go through a programmed cell death, leading to a direct anti-cancer effect. So along with all the other benefits of ozone, we are able to see a direct impact on various forms of cancer. And finally, we can talk about how do we actually do these therapies at the center here. There are two main ways that we do this. One is called UBI, which is ultraviolet blood irradiation using ozone, and the other one is 10 Pass Ozone or major autologous hemotherapy. So what we do in UBI is we take 120 mLs of blood from your vein, and we infuse 360 ml of ozone at 70 gamma into your body through a machine called an ultraviolet irradiator. So what this does is not only it infuses ozone directly into your body, but the blood also passes through an ultraviolet irradiator, which is directly antimicrobial. So that's one method, and that takes about 45 minutes or so. The other is a 10 pass ozone. And what we do with that is we use a glass bottle and we draw 200 mLs of blood from your vein and we put it into the glass bottle. Then we infuse the same amount of ozone into the bottle, and then we put it back into your body, and that is one pass. We try to do this up to 10 times as long as your veins permit. And this way you get a much bigger dose of ozone. This can take about an hour to hour and a half. And so both these therapies can be very helpful depending on your needs and your health. Who should use this therapy? Who should benefit from it? Who should try? Who should give this a shot? People that are currently facing chronic issues like cancer, autoimmune illnesses, they should try ozone therapy. because it can be very synergistic with all the other therapies that you're doing. It is directly anti-cancer. It is directly an immune system modulator, which means if your immune system is overactive, it'll help to tamp it down. If it is underactive, it'll help to boost it. So very helpful for autoimmune issues, for cancer, for any kinds of chronic infections that you may have. If you have an underlying HPV infection or EBV infection, or you have recurring shingles, or even if you have mold, all of these infections and toxins are directly countered by ozone. So it could be very helpful therapy for you. And if you are healthy and do not have a chronic disease state, that's very good. But ozone can still help you. You would just do it much less frequently. So let's say a 10 pass would be done a couple times a year. And that would just help to keep your health in a state of balance, in a state of vitality. And if your health is less than perfect, then you can do it more frequently. Of course, the amount and the frequency of ozone that you should get will be determined based on your health by your healthcare practitioner. Thank you for spending some time with me today learning about ozone therapy. If you have any questions or comments, please leave them for us, and we will try and address them for you.